Hi, Mark Grant here with a few words to introduce you to my workshop, EMDR and the Treatment of Chronic Pain and Medically Unexplained Symptoms. That's available online and here and there live. So let's start off with this little thing. Pain is in the brain, even though it starts in the body. Why am I saying that? Because this little thing that you have in your head isn't just something that receives pain signals from the body, it also generates its own experience. So it receives and it transmits. And it does that in a very particular way. So when your brain, when it has an experience, sensory information enters the brain. It has an emotional response to it through the structures of the limbic system, and a cognitive response through the prefrontal cortex, which then decides, interprets the meaning of the event and decides what to do about it. And over time, if you experience something repeatedly or something very traumatic, such as physical or sexual abuse, or emotional neglect, or attachment problems, or adversity in childhood, the brain actually starts to, through neuroplasticity, develop memories of that event. And to cut a long story short, because of the increased activity of the amygdala, which is located in your limbic system there, the brain becomes unable to integrate that information and lay it down in the hippocampus, which is where memories are encoded. So the information remains frozen in the brain and it's constantly replayed as traumatic intrusions, memories, feelings and sensations. And secondly, another thing that happens is that because the brain is in a state of constant fight, flight, and often the person is not really taking very good care of themselves in their life because of the effects of the trauma, their brain and their body sort of start to develop fatigue and various somatic symptoms that are medically unexplained pain. So for all these reasons, a treatment approach that is trauma-focused, such as EMDR, is indicated. One other thing is that the brain also primarily processes sensory information in a bottom-up fashion. So treatments that work from a bottom-up perspective, such as EMDR or somatic experiencing, are a more effective way to change the sensory memories that maintain chronic pain and medically unexplained symptoms, in contrast to traditional talk therapy. So, in this workshop, I'll be explaining how the brain is involved in chronic pain, how to develop a trauma-informed case conceptualization and using that broad definition of trauma that I've just described, how to recognize normal dissociative phenomena in chronic pain, the EMDR pain protocol, and 8 ways in which it differs from the standard trauma protocol. We'll be looking at safety issues that are unique to pain and medically unexplained symptoms. So we know about safety and how important that is from our trauma work, but it manifests a little bit differently in people with pain and disability. For example, uncontrolled pain is a safety issue. Not having a trusting relationship with caring professionals is a safety issue. Not being able to trust in your body to perform the way you need it to is a safety issue. So you can see how safety as a theme presents differently in pain sufferers. We'll also then look at how to develop EMDR pain targets for effective treatment of pain, how to maximize the physiological effects of bilateral stimulation in the treatment of pain. And this is a very important element because it's the bilateral stimulation and the physiological responses to that, which is really one of the core and defining elements of EMDR, and certainly something that can drive your effective treatment of this problem. We'll be looking at how to create resources based on the sensory changes that clients experience, following bilateral stimulation, particularly for the management of treatment-resistant pain, which is often a factor in this kind of work. I'll also be showing you how to supplement EMDR with adjunctive strategies such as hypnosis and somatic therapies. And this is particularly necessary because really when you're treating chronic pain, you may as well think that you're treating CPTSD, because there are so many overlapping contributing factors, whether it's emotional neglect in childhood, attachment problems, physical or sexual abuse, health problems, other forms of adversity. It's plus dissociation. It's just not a simple case of targeting traumas and processing your way through sequentially to the end. So we'll look at eight ways in which hypnosis can enhance EMDR, and in that I'll be showing you a lot of the hypnosis that is already in EMDR that is not identified as such, and I'll be showing you 5 hypnotic strategies that you can use as an adjunct to EMDR for treatment-resistant pain. So you'll learn how to understand pain and medically unexplained symptoms as a manifestation of unresolved trauma, again in that broadest sense. How to use EMDR, how to know when to supplement EMDR with other treatment interventions, how to incorporate ego state work as a hypnotic intervention, and how to work with the body to maximize the efficacy of this treatment approach. Everything will be demonstrated through didactic lecture, videos of real case treatment. You'll get a copy of my pain protocol, worksheets and tip sheets, and a bundle of 12 hypnosis scripts for working with treatment-resistant pain. So I'm sure you'll find this an interesting and useful workshop that will greatly enhance your treatment of this very complex population.